Well, with us now from central London is John Dunne, the Director of the UK Vaping Industry Association. Very good morning to you. I suppose this is positive news for an organisation like yours, then?
I think it's extremely positive for the entire industry. We're lucky in this country that we have a government and health organisation that's extremely pro-vaping and very positive on vaping, and that's not necessarily the same around the world.
It is interesting, though, because I remember just a couple of days ago, I think it was Birmingham University did a study suggesting that actually e-cigarettes are a lot more harmful than many people are aware of.
Well, I think that study, is still very young. It's a very small study, and I'm not a doctor, so we'll wait for the medical community to take a look at that. But what we do know is that electronic cigarettes, when you compare them to smoking, are at least 95% safer than smoking, and that's the positive thing that we should be reinforcing.
Is there an argument, though, that at the moment, there's not enough research, we don't know the full extent of what could be the implications of smoking e-cigarettes regularly, and so perhaps more research needs to be done before people can be promoting them instead of smoking cigarettes?
Well, I agree with you that there needs to be more research, but again, this is a very new science. But there is an awful lot of research out there that shows the major health benefits of vaping. But what we do know is that smoking cigarettes will kill you. So if you're going to do something, you're much better to go to vaping than you are to continue to smoke.
I mean, vaping certainly seems like the new thing to do. It's a bit of a trend at the moment, isn't it? And is there a worry that, it might encourage more youngsters to take it up or even smoking instead?
Well, the UK has been monitoring that for quite so many years, and we really haven't seen an uptake. The latest figure that I saw was 0.5% of uptake is within under the age of 18.
We've obviously got rid of smoking in public areas in this country. This report suggesting that perhaps in hospitals they should introduce vaping rooms. Do you think that's a good idea?
I definitely think it's a good idea. One of the issues at the moment is because there is no definite regulation around where you can and cannot vape, what we're finding is that due to a lot of confusion, that vapers are being put outside with smokers, and that's not a good thing to do. It's like putting an alcoholic into a bar. So I think it's a great idea for hospitals, especially with patients that can't go out and really have no other choice, to give them an area where they can vape and that doesn't affect the other patients.
But at the same time, is this not kind of going back on this, rule of getting rid of smoking areas in public places, and then, once again, it might encourage others to start vaping?
There's no evidence that there is a link between vaping and smoking actual cigarettes. But I disagree that this is normalising smoking. This is vaping, this is not smoking. It's very different.
Is there a chance that from vaping regularly over a period of time that could increase the chance of a person getting lung cancer or lung disease?
I have seen no evidence to that point.
OK, so why do you think vaping is the better way to go for people who are trying to give up smoking?
I think it all comes down to basically mimicking the hand-to-mouth gestures of smoking. That's one of the things that patches and gums and other NRTs lack, and I think that's one of the reasons why vaping has become so successful.
OK, John Dunne, thank you for joining us. Thanks for sharing your thoughts. Appreciate your time.